Hi, hello, good afternoon, viewers. Welcome back to our live. Today, I have Dr. Nidhi Nandan with us, Senior Consultant OBG and Gynae, to discuss all your queries on HPV vaccine, which is important to all age group of women, right, from teenage to elderly age. And Doctor, the first question would be: could you explain me the importance of HPV vaccine and preventing certain cancers and how effective it is?
Right, Jitendra, HPV or human papillomavirus, it is a group of around 200 strains of related viruses, which can affect both men and women. Uh, there are certain cancers which are caused by the HPV strains like type 16, 18, 31, 33, 58, which can cause various cancers and genital warts. Cancers caused by HPV viruses are preventable, and it is seen that countries where the HPV vaccine is being incorporated in the national immunization program, there is a significant reduction in the disease caused by the HPV. And so hence the HPV vaccine, it protects against these harmful strains of the viruses and can prevent and reduce the risk of cancers and genital warts.
Okay, doctor. Doctor, what are the types of HPV vaccines available?
There are three types of virus. The HPV vaccines are available. One is Cervarix, which is the bivalent. Another is Gardasil, which is a quadrivalent vaccine. And the latest series has come back as Gardasil 9, which is a nonavalent vaccine.
Okay, doctor. And what is the age group that you recommend for HPV vaccine?
The HPV vaccination is recommended as a routine vaccine for all the adolescent boys and girls age 11 to 12 years of age. Though it can be given from the beginning of 9 years of age. Everyone till the age of 26, it is recommended to have a HPV vaccine.
Okay.
Adults also, since this vaccine is licensed to be used till 45 years of age, okay. So adults more than 27 years till age of 45, they can also have the vaccine.
Okay, doctor. And what is the recommended vaccination schedule, and what if they miss any schedule of the vaccine?
Right, so the recommended schedule is that girls and boys who are more than 9 years till age of 14 years, they need 2 doses of vaccine, okay. 6 monthly apart. Okay. 15 years old and above, and any young individual who are immunocompromised, they need 3 doses of vaccine. The second dose should be at least 1 to 2 months apart, and the third dose should be after 6 months of the first dose.
Okay, doctor. Doctor, is HPV vaccine effective for both male and females?
Yes, vaccine is absolutely safe for both men and women. It is equally effective and protective for boys and girls. Okay. Initially, it was seen that when it was launched in 2006, it was basically licensed for the girls because mostly at that time the data were generated for the girls. But after that, there is a lot of research has happened, okay. And there is evident data which says that it is recommended for both boys and girls.
Okay. Doctor, is there any side effects associated with this HPV vaccine?
There is no serious side effects for this vaccine, okay. But like any other general vaccination, that you may feel, you may have fever, you may feel pain and redness and swelling at the injection site. There can be muscle or bony ache pains. So all those type of minor symptoms can happen.
Okay. How long does the immunity of HPV vaccine last?
HPV vaccine is providing a long-lasting protection against the HPV disease and associated disease, and it is seen that immunity lasts for approximately 10 to 12 years.
Okay. Doctor, are there any booster shots necessary?
There is no recommendation for any booster dose yet.
Okay. Doctor, are there any conditions where patients or people are not advised for HPV vaccine?
There are certain conditions where we say that you should avoid taking HPV vaccine. For example, the patients who had an allergic reaction after taking the first dose of the vaccine, or anybody who had life-threatening severe allergic reactions. It is also not recommended in the pregnant women. And we also say that the young people or the people who are moderately to severely ill, they should first treat themselves and get recovered and then have the vaccine.
Okay. What if individual is already diagnosed with HPV infection and they receive vaccine? Will it be beneficial for them?
Yes, the individual who already have been diagnosed to have HPV infection, they also can have HPV vaccine. Though HPV vaccine will not cure your current HPV infection, but it can prevent any other strains if the individual pick up for which they are not exposed to yet.
Okay. Doctor, can the HPV vaccine administered with other routine vaccines?
Yes, it is safe to administer the HPV vaccine with other routine vaccination.
Okay, doctor. Doctor, to conclude this, are there any research going on this related to HPV vaccine that people should be aware of?
There are a lot of ongoing research happening still for the HPV vaccine, and one of them is to see if we can have a single dose HPV vaccine, which can be as effective as giving towards 2 or 3 doses of vaccine. So in India, when we see there is a higher burden of cervical cancer, and still access to the prevention measures are still on the lower side, it will be really good if we have a single dose immunization program which will facilitate to scale up the HPV vaccination program.
Okay. Thank you so much, doctor, for your time and valuable insights. I think this will help us, all our audience. It will create an awareness among all of them, so that they'll be in a safer side by taking HPV vaccines. And thank you, viewers, for joining us. And to book your in-person appointment with Dr. Nidhi Nandan, you can log on to our website and you can book your personal appointments with her. You can download our app from app from Play Store, Sakra Patient app, and you can book appointments from there also. And keep following us. We'll keep you updated with all the health insights. Thank you.
Thank you.